Psychiatry perspective with emphasis on pharmacological development. Schizophrenia, a chronic and debilitating mental disorder, has witnessed significant advancements in recent years across various domains, including genetics, neurobiology, pharmacotherapy, personalized medicine, early intervention, and innovative therapeutic approaches. This discussion highlights these advancements with a particular focus on recent developments in pharmacological treatments. 1. Genetic and molecular insights. Genome-wide association studies, GWAS. Identification of numerous genetic variants linked to schizophrenia has enhanced the understanding of its heritability. Notably, variants in the complement component 4C4 gene have been associated with synaptic pruning abnormalities, offering insights into disease mechanisms. Polygenic risk scores, PRS. Development of PRS enables the assessment of an individual's genetic susceptibility, facilitating early identification and potential preventative strategies. 2. Neurobiological advances. Neuroimaging techniques, high-resolution imaging, including functional MRI and diffusion tensor imaging, has elucidated altered brain connectivity patterns in schizophrenia, particularly within the default mode and frontotemporal networks. Biomarkers. Research into biomarkers such as neuroinflammatory markers and brain-derived neurotrophic factor, BDNF, holds promise for early diagnosis and monitoring disease progression. 3. Immunological and inflammatory research. Neuroinflammation, elevated pro-inflammatory cytokines, and increased microglial activation observed through PET imaging suggests that immune dysregulation plays a role in schizophrenia, opening avenues for anti-inflammatory treatments. 4. Gut-brain axis and microbiome studies. Microbiota composition. Alterations in gut microbiota have been linked to schizophrenia, influencing neurotransmitter pathways and immune responses. Probiotic interventions are being explored to modulate gut flora and alleviate psychiatric symptoms. 5. Advancements in pharmacotherapy. Third-generation antipsychotics. Cariprazine, approved for both schizophrenia and bipolar disorder. Cariprazine acts as a dopamine D3/2 receptor partial agonist with a preference for D3 receptors. It has shown efficacy in treating negative and cognitive symptoms with a favorable side effect profile. Lumaparone Caplita, a novel antipsychotic approved for schizophrenia. Lumaparone modulates serotonin, dopamine, and glutamate neurotransmission. It is associated with fewer extrapyramidal symptoms and a lower risk of metabolic side effects. Brexpiprazole, Rexulti. Similar to cariprazine, brexpiprazole is a dopamine D2 and serotonin 5-HT1, a receptor partial agonist and 5-HT2A antagonist. It is effective in reducing both positive and negative symptoms with improved tolerability. Glutamatergic agents, bidopertin, an investigational glycine reuptake inhibitor targeting the glycine site of the NMDA receptor. Bidopertin aims to enhance NMDA receptor function, addressing cognitive and negative symptoms. While initial trials showed promise, further research is ongoing to establish its efficacy. D-serine and sarcosine, these endogenous co-agonists of the NMDA receptor, are being studied as adjunctive treatments to improve cognitive deficits and negative symptoms in schizophrenia. Long-acting injectables, LAIs, aripiprazole Laroxil Aristada, a once-monthly LAI that provides stable plasma levels of aripiprazole, improving adherence and reducing relapse rates. Risperidone Ism Risperdal Consta, an injectable formulation offering a flexible dosing regimen and improved tolerability. Novel mechanisms and emerging therapies. Cannabidiol CBD, investigated for its antipsychotic properties. CBD has shown potential in reducing psychotic symptoms with a favorable safety profile. Pimavanserin Nuplazid, although primarily approved for Parkinson's disease psychosis, pimavanserin's selective serotonin 2, a inverse agonism, is being explored for schizophrenia-related psychosis. TAR1 agonists, therapeutic agents like ulotaront, CEP 363856 act on trace amine-associated receptor 1, TAR1, and serotonin 5-HT1 receptors, offering a novel mechanism distinct from traditional dopaminergic antipsychotics. Early studies indicate efficacy in positive and negative symptoms, with minimal extrapyramidal side effects. 6. Personalized medicine and pharmacogenomics. Tailored treatments. Genetic testing informs the selection of antipsychotics based on individual metabolic profiles, minimizing adverse effects and optimizing therapeutic response. Biomarker-guided therapy, utilizing biomarkers to predict treatment response, allows for more personalized and effective interventions. 7. Early intervention and prevention. Prodromal phase identification. Recognizing early signs and symptoms facilitates interventions that may delay or prevent the onset of full-blown schizophrenia. Cognitive behavioral therapy, CBT. Implementing CBT during the prodromal phase has been shown to reduce the transition rate to psychosis. 8. Cognitive remediation and rehabilitation. Cognitive training programs, computerized cognitive remediation therapies improve neurocognitive deficits, enhancing functional outcomes and quality of life. Social skills training, programs focusing on social cognition, assist patients in better navigating social interactions and improving interpersonal relationships. 9. Digital health and telepsychiatry. O mobile health applications. Apps designed for symptom tracking, medication reminders, and psychoeducation support self-management and adherence. Telepsychiatry services. Remote consultations increase access to care, particularly in underserved areas, and have gained prominence post-COVID-19. 10. Novel therapeutic approaches. O transcranial magnetic stimulation, TMS. TMS has shown efficacy in alleviating negative symptoms and auditory hallucinations by modulating cortical activity. Psychedelic research. Controlled studies on substances like psilocybin are investigating their potential to reset dysfunctional neural circuits, though further research is necessary. Conclusion. The landscape of schizophrenia research and treatment is rapidly evolving, integrating genetic, neurobiological, and psychosocial advancements. Notably, pharmacological innovations, including third-generation antipsychotics, glutamatergic agents, long-acting injectables, and novel mechanisms like TAAR1 agonists, are enhancing therapeutic efficacy and tolerability. These developments not only deepen the understanding of schizophrenia's etiology, but also enhance diagnostic precision and treatment personalization. Continued interdisciplinary research and the adoption of personalized medicine approaches hold the promise of significantly improving outcomes and the quality of life for individuals affected by schizophrenia. Recent advances in mood disorders, a psychiatry perspective mood disorders, encompassing conditions such as major depressive disorder MDD, bipolar disorder BD, and related affective illnesses, are prevalent and significantly impact individuals' quality of life. Recent advancements in understanding and managing mood disorders span genetic research, neurobiology, pharmacotherapy, psychotherapy, digital health, and personalized medicine. This overview highlights the key developments in these areas. 1. Genetic and molecular insights. Genome-wide association studies, GWAS, O findings. GWAS have identified numerous genetic variants associated with mood disorders, enhancing the understanding of their heritability. For instance, variants in the BDNF brain-derived neurotrophic factor and COMT catechol O methyltransferase genes have been linked to depression and bipolar disorder. Implications. These discoveries facilitate the identification of biological pathways involved in mood regulation, paving the way for targeted therapies. Epigenetics O research. Studies on DNA methylation and histone modification reveal how environmental factors influence gene expression related to mood disorders. Applications. Epigenetic markers may serve as potential biomarkers for diagnosis and treatment response prediction. 2. Neurobiological advances. Neuroimaging techniques, O functional MRI, fMRI, and PET scans. Advanced imaging has elucidated alterations in brain regions such as the prefrontal cortex, amygdala, and hippocampus in individuals with mood disorders. Connectivity studies. Research on neural network connectivity, including the default mode network DMN and salience network, has provided insights into the pathophysiology of mood disorders. Biomarkers, O inflammatory markers, elevated levels of cytokines, e.g. IL-6, TNF-alpha, have been associated with depression, suggesting an inflammatory component. Neurotrophic factors, reduced levels of BDNF, are implicated in mood disorders, leading to exploration of treatments that can enhance neuroplasticity. 3. Advancements in pharmacotherapy. Novel antidepressants and mood stabilizers, O-esketamine Spravato, an NMDA receptor antagonist approved for treatment-resistant depression, offering rapid antidepressant effects. Brexanolone Zulresso, approved for postpartum depression. It modulates the GABAergic system to alleviate depressive symptoms. O. Lurasidone Latuda, an atypical antipsychotic approved for bipolar depression, providing a new option for mood stabilization. Glutamatergic agents, O. Rapastinel and AV101, investigated for their potential to target the glutamate system, offering rapid antidepressant effects with fewer side effects compared to traditional treatments. Anti-inflammatory agents, O. Celecoxib and minocycline. Studies suggest that adjunctive anti-inflammatory medications may enhance antidepressant efficacy in patients with elevated inflammatory markers. Personalized pharmacotherapy, O. Pharmacogenomic testing, utilization of genetic profiles to predict patient response to specific antidepressants and mood stabilizers, thereby optimizing treatment strategies and minimizing adverse effects. 4. Psychotherapeutic innovations. Cognitive behavioral therapy CBT enhancements, O. Internet-based CBT ICBT, expansion of digital platforms delivering CBT, increasing accessibility and adherence. Mindfulness-based cognitive therapy MBCT combines mindfulness practices with CBT to prevent relapse and recurrent depression. Interpersonal and social rhythm therapy IPSRT, O. application, particularly effective in bipolar disorder. IPSRT focuses on stabilizing daily routines and improving interpersonal relationships to manage mood fluctuations. Acceptance and commitment therapy, ACT, O approach, encourages acceptance of negative thoughts and feelings while committing to actions aligned with personal values, showing efficacy in treating depression and anxiety, comorbid with mood disorders. 5. Digital health and technology integration, mobile health and health applications, O features, apps for mood tracking, cognitive behavioral exercises, mindfulness training, and medication reminders support self-management. Benefits, enhanced patient engagement, real-time monitoring, and personalized interventions. Telepsychiatry, O expansion. Increased use of remote consultations, particularly accelerated by the COVID-19 pandemic, improving access to mental health services in underserved areas. Effectiveness. Studies indicate that telepsychiatry is as effective as in-person therapy for mood disorders. Wearable devices, O usage, monitoring physiological indicators such as sleep patterns, activity levels, and heart rate variability to predict mood episodes and provide timely interventions. 6. Personalized medicine and precision psychiatry. Biomarker-guided treatment, O implementation, utilizing biomarkers, genetic, neuroimaging, inflammatory to tailor treatment plans specific to an individual's biological profile. Outcomes, enhanced treatment efficacy, reduced trial and error prescribing, and minimized side effects. Subtyping mood disorders, O research, identifying distinct subtypes based on genetic, neurobiological, and clinical features to inform targeted therapeutic approaches. 7. Early intervention and prevention strategies. Identification of at-risk populations, O strategies. Screening for early signs and symptoms in high-risk groups, e.g., family history, adolescents, to implement preventive measures. Interventions, early psychotherapeutic and pharmacological interventions, can delay or prevent the onset of full-blown mood disorders. Psychoeducation and support programs, O programs, educating patients and families about mood disorders to enhance recognition, reduce stigma, and promote proactive management. 8. Cognitive remediation and rehabilitation. Cognitive behavioral approaches, O techniques, addressing cognitive distortions and enhancing problem-solving skills to improve mood regulation and functional outcomes. Neurofeedback, O method, training individuals to regulate brain activity through real-time feedback, showing potential in managing depressive symptoms. 9. Advancements in neurostimulation therapies. Transcranial magnetic stimulation, TMS, O applications, FDA approved for treatment-resistant depression with ongoing research into its efficacy for bipolar disorder. Technological improvements, development of personalized TMS protocols targeting specific brain regions. Electroconvulsive therapy, ECT enhancements, O refinements, improve techniques to minimize cognitive side effects while maintaining therapeutic efficacy. Vagus nerve stimulation, VNS, and deep brain stimulation, DBS, O exploration, investigating their roles in treatment-resistant mood disorders, offering alternative options for severe cases. 10. Novel therapeutic approaches. Ketamine therapy, O usage beyond esketamine, low-dose ketamine infusions are being explored for rapid relief of depressive symptoms. Mechanism, modulation of glutamate neurotransmission, and enhancement of synaptic plasticity. Psychedelic-assisted therapy, O research, controlled studies on substances like psilocybin and MDMA show promise in treating depression and bipolar disorder by facilitating profound psychological experiences that promote healing. Gut-brain axis modulation, O interventions, probiotic and dietary interventions, targeting the microbiome to influence mood regulation and reduce depressive symptoms. Conclusion. The field of mood disorders is experiencing transformative advancements driven by multidisciplinary research and technological innovations. Genetic and neurobiological insights are unraveling the complex underpinnings of these conditions, while novel pharmacological treatments offer more effective and faster-acting options. Psychotherapeutic approaches are becoming more accessible and tailored, supported by digital health tools that enhance patient engagement and treatment adherence. Personalized medicine, guided by biomarkers and genetic profiles, is paving the way for precision psychiatry, ensuring that treatments are optimized for individual needs. Additionally, emerging therapies such as neurostimulation and psychedelic-assisted treatments are expanding the therapeutic arsenal available to clinicians. Collectively, these advancements hold the promise of improving outcomes, reducing the burden of mood disorders, and enhancing the quality of life for affected individuals. Recent advances in child psychiatry, a comprehensive overview. Child psychiatry has undergone significant transformations in recent years, driven by advancements in research, technology, and clinical practices. These developments have enhanced the understanding, diagnosis, and treatment of psychiatric disorders in children and adolescents, ultimately improving outcomes and quality of life. The following sections highlight the key recent advances in the field of child psychiatry. 1. Neurodevelopmental and neuroimaging insights. Advanced neuroimaging techniques, O-functional MRI, fMRI, and diffusion tensor imaging, DTI. These tools have provided deeper insights into the developing brain, revealing atypical neural connectivity patterns associated with disorders such as autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. Early detection neuroimaging biomarkers are being explored for early identification of children at risk for psychiatric disorders, allowing for timely interventions. Understanding brain development, O critical periods. Research has elucidated critical periods in brain development where
ASD and attention deficit hyperactivity disorder, ADHD. Early detection neuroimaging biomarkers are being explored for early identification of children at risk for psychiatric disorders, allowing for timely interventions. Understanding brain development, O critical periods. Research has elucidated critical periods in brain development where interventions can be most effective, particularly in conditions like ASD and learning disabilities. Neuroplasticity. Enhanced understanding of neuroplasticity has informed therapeutic approaches that leverage the brain's ability to reorganize and adapt. 2. Genetics and genomics. Genomic studies. Genome-wide association studies, GWAS. Identification of genetic variants linked to psychiatric conditions such as ADHD, depression, and anxiety disorders has improved the understanding of their etiology. Copy number variations. CNVs. Research into CNVs has revealed associations with neurodevelopmental disorders, aiding in diagnosis and personalized treatment planning. Polygenic risk scores, PRS, risk assessment. PRs are being developed to estimate an individual child's genetic susceptibility to various psychiatric disorders, facilitating early intervention strategies. 3. Digital psychiatry and telehealth. Telepsychiatry, increased access. The expansion of telepsychiatry services, accelerated by the COVID-19 pandemic, has improved access to mental health care for children in remote and underserved areas. Effectiveness. Studies indicate that telepsychiatry is as effective as in-person consultations for diagnosing and managing common child psychiatric conditions. Digital therapeutics, mobile applications and online platforms. Digital tools for cognitive behavioral therapy, CBT, mood tracking, and behavioral interventions are becoming integral parts of treatment plans. Gamification, interactive, and game-based therapies engage children more effectively, enhancing adherence and therapeutic outcomes. 4. Innovative psychotherapeutic approaches. Trauma-informed care, enhanced understanding, increased recognition of the impact of adverse childhood experiences, ACEs, has led to the integration of trauma-informed practices and treatment protocols. Therapeutic modalities, approaches such as trauma-focused cognitive behavioral therapy, TFCBT, are widely adopted for children experiencing trauma and PTSD. Mindfulness and acceptance-based therapies, mindfulness-based cognitive therapy, MBCT, adapted for children. MBCT helps in managing anxiety, depression, and stress by promoting present moment awareness and acceptance. Acceptance and commitment therapy, ACT, utilized to improve emotional regulation and coping strategies in children with various psychiatric conditions. 5. Pharmacological advances. New medications, second-generation antipsychotics, enhance safety profiles and efficacy for treating conditions like irritability and ASD and bipolar disorder in adolescents. Stimulant alternatives for ADHD. Medications such as guanfacine extended release and clonidine are being used as non-stimulant options with fewer side effects. Personalized pharmacotherapy, pharmacogenomics. Genetic testing is increasingly used to tailor medication choices and dosages, minimizing adverse effects and optimizing therapeutic responses. Biomarker-guided treatment. Research into biomarkers for predicting medication response is paving the way for more individualized treatment plans. 6. Early intervention and prevention strategies. Routine assessments, implementation of screening tools in schools and pediatric settings to identify early signs of psychiatric disorders. Preventive interventions, programs targeting at-risk children to provide support and strategies that may prevent the development or worsening of psychiatric conditions. Parent-child interventions, parent training programs, enhancing parenting skills to improve child behavior and emotional regulation, particularly in children with behavioral disorders. Family therapy, addressing family dynamics and improving communication to support the child's mental health. 7. Integrated care models, collaborative care, multidisciplinary teams, integration of psychiatrists, psychologists, social workers, and educators to provide comprehensive care. Co-location of services, offering mental health services within primary care settings to streamline access and reduce stigma. School-based mental health services, on-site support, deployment of mental health professionals in schools to provide immediate support, counseling, and intervention. Collaborative programs, partnerships between schools and mental health services to address academic and emotional needs concurrently. 8. Biomarkers and precision psychiatry. Identification of biological markers, neurochemical indicators, research into neurotransmitter levels, inflammatory markers, and hormonal profiles to aid in diagnosis and treatment selection. Genetic markers, utilization of specific genetic profiles to predict disease course and treatment response. Precision psychiatry, tailored treatments combining genetic, neuroimaging, and clinical data to develop highly personalized treatment plans. Predictive modeling, use of machine learning and artificial intelligence to predict treatment outcomes and optimize interventions. 9. Advances in specific disorder treatments. Autism spectrum disorder, ASD, behavioral interventions, enhanced applied behavior analysis, ABA techniques and integration with technology for more effective therapy. Sensory integration therapy, improved methods for addressing sensory processing issues commonly seen in ASD, Attention deficit hyperactivity disorder ADHD, non-pharmacological treatments, increased emphasis on behavioral therapies, executive function training, and lifestyle modifications. Neurofeedback, emerging evidence supports the use of neurofeedback as an adjunctive treatment for ADHD. Anxiety and depression, transdiagnostic approaches, therapies that address underlying cognitive and emotional processes common to multiple disorders. Peer support programs, incorporation of peer-led initiatives to provide social support and reduce feelings of isolation. 10. Policy, education, and training enhancements. Improved access to care, policy initiatives. Legislative efforts to increase funding for child mental health services and reduce barriers to access. Insurance coverage. Expansion of insurance coverage to include a wider range of mental health services for children. Training and education. Specialized training programs, enhanced training for healthcare providers in child and adolescent psychiatry, including cultural competence and trauma-informed care. Public awareness campaigns, efforts to destigmatize mental health issues and promote understanding among parents, educators, and the community. Conclusion. The field of child psychiatry is rapidly evolving, driven by interdisciplinary research, technological innovations, and a deeper understanding of the complex interplay between genetics, environment, and neurobiology. Advances in neuroimaging, genomics, digital health, and personalized medicine are revolutionizing the diagnosis and treatment of psychiatric disorders in children and adolescents. Moreover, the integration of mental health services into broader healthcare and educational systems, along with early intervention and prevention strategies, are pivotal in addressing the growing mental health needs of the younger population. Continued investment in research, policy development, and education is essential to sustain and further these advancements, ultimately enhancing the mental well-being and developmental outcomes of children worldwide. Recent advances in neuropsychiatry, an in-depth overview, neuropsychiatry, an interdisciplinary field bridging neurology and psychiatry, focuses on the interplay between neurological disorders and psychiatric symptoms. Recent advancements in neuropsychiatry have significantly enhanced our understanding, diagnosis, and treatment of complex neuropsychiatric conditions. This overview delineates the key recent developments across various domains within neuropsychiatry. 1. Advanced neuroimaging techniques. High-resolution functional imaging, functional MRI, fMRI enhancements. Improved spatial and temporal resolution has facilitated better mapping of brain activity associated with psychiatric symptoms, aiding in the differentiation of disorders like depression, schizophrenia, and bipolar disorder. Positron emission tomography PET advances. PET imaging has become more refined in tracking neurotransmitter systems, such as dopamine and serotonin pathways, providing insights into their roles in neuropsychiatric conditions. Connectomics, brain connectivity mapping, the study of brain networks and their connectivity patterns has advanced, revealing disruptions in connectivity in disorders like autism spectrum disorder, ASD, ADHD, and obsessive compulsive disorder, OCD. Default mode network DMN studies. Research into the DMN has elucidated its involvement in self-referential thinking and its dysregulation in conditions such as depression and anxiety. 2. Genetic and genomic discoveries. Genome-wide association studies GWAS, identification of risk genes. GWAS have identified multiple genetic variants associated with neuropsychiatric disorders, enhancing the understanding of their heritability and biological underpinnings. Polygenic risk scores PRS. Development of PRs allows for the estimation of an individual's genetic predisposition to disorders like schizophrenia, bipolar disorder, and major depressive disorder, facilitating early intervention strategies. Epigenetics, gene-environment interactions. Studies on DNA methylation and histone modifications have revealed how environmental factors influence gene expression related to neuropsychiatric conditions. Biomarker development. Epigenetic markers are being explored as potential biomarkers for diagnosis and treatment response prediction. 3. Neuroinflammation and immune system involvement. Role of neuroinflammation, inflammatory markers. Elevated levels of cytokines, e.g. IL-6, TNF-alpha, have been implicated in disorders such as depression, schizophrenia, and bipolar disorder, suggesting a link between inflammation and psychiatric symptoms. Microglial activation. Increased activation of microglia, the brain's immune cells, has been observed in various neuropsychiatric conditions, indicating potential targets for anti-inflammatory therapies. Autoimmune neuropsychiatric disorders, autoimmune encephalitis. Advances in identifying autoimmune causes of psychiatric symptoms have improved diagnosis and treatment, particularly in conditions presenting with sudden onset psychosis or mood disturbances. 4. Neurotransmitter system research. NMDA receptor modulators. Medications targeting the NMDA receptor, such as ketamine and esketamine, have shown rapid antidepressant effects, revolutionizing treatment approaches for treatment-resistant depression. AMPA receptor agonists. Research into AMPA receptor modulators is ongoing, aiming to enhance synaptic plasticity and cognitive function in neuropsychiatric disorders. GABAergic system, GABA modulators. New therapies targeting the GABA system are being developed to address anxiety, epilepsy, and mood disorders, offering alternatives to traditional benzodiazepines with improved safety profiles. 5. Biomarkers and precision medicine. Biomarker identification, neurochemical biomarkers. Identification of specific neurochemical profiles associated with different neuropsychiatric disorders aids in accurate diagnosis and personalized treatment planning. Imaging biomarkers. Advanced neuroimaging biomarkers are being utilized to predict treatment response and disease progression, enhancing clinical decision-making. Precision psychiatry, personalized treatment plans. Integration of genetic, biomarker, and clinical data enables the development of tailored treatment strategies, optimizing therapeutic efficacy and minimizing adverse effects. Machine learning and AI. Utilization of artificial intelligence in analyzing complex data sets facilitates the prediction of treatment outcomes and the identification of novel therapeutic targets. 6. Innovative pharmacological treatments. Novel antidepressants and antipsychotics, esketamine Spravato. Approved for treatment-resistant depression, esketamine offers a rapid mechanism of action through NMDA receptor antagonism. Depression. Esketamine offers a rapid mechanism of action through NMDA receptor antagonism. Brexanolone Zulresso, approved for postpartum depression, it modulates the GABAergic system to alleviate depressive symptoms. Novel mechanisms of action, TAR1 agonists, trace amine-associated receptor 1 TAR1 agonists, such as ulotaront CEP 363,856, provide antipsychotic effects without the typical dopamine receptor antagonism, reducing the risk of extrapyramidal side effects. Psychedelic compounds. Controlled use of psychedelics like psilocybin and MDMA is being explored for their potential to induce neuroplasticity and therapeutic psychological experiences in conditions like PTSD and depression. 7. Non-pharmacological therapeutic approaches. Neurostimulation techniques, transcranial magnetic stimulation, TMS. Advances in TMS protocols, including personalized targeting and optimized dosing, have improved its efficacy in treating depression, OCD, and other neuropsychiatric disorders. Deep brain stimulation, DBS. Refinements in DBS targeting and programming have expanded its use in treatment-resistant depression, obsessive-compulsive disorder, and Tourette syndrome. Cognitive behavioral therapy CBT innovations, digital CBT, online and app-based CBT platforms have increased accessibility and adherence, particularly during the COVID-19 pandemic. Integrative therapies, combining CBT with mindfulness and acceptance-based strategies, has enhanced treatment outcomes for various neuropsychiatric conditions. 8. Neurodevelopmental and pediatric neuropsychiatry. Early intervention strategies, developmental screening. Improved screening tools for early detection of neuropsychiatric disorders in children, such as ASD and ADHD, allow for timely interventions. Neuroprotective treatments. Research into neuroprotective agents aims to mitigate the impact of early life stressors and neurological insults on the developing brain. Genetic therapies, gene editing. Emerging techniques like CRISPR-Cas9 hold potential for correcting genetic mutations associated with neurodevelopmental disorders, though clinical applications are still in early stages. 9. Integration of technology and digital health. Telepsychiatry, expanded access. Telepsychiatry has become a cornerstone in delivering mental health services, particularly in underserved and remote areas, ensuring continuity of care during global disruptions like the COVID-19 pandemic. Virtual reality VR therapies, VR-based interventions are being developed for exposure therapy in anxiety disorders, PTSD, and for cognitive rehabilitation. Wearable technology and biofeedback, real-time monitoring. Wearable devices track physiological parameters such as heart rate variability and sleep patterns, providing data that can inform treatment adjustments. Biofeedback interventions, integrating biofeedback with therapeutic practices, enhances self-regulation and stress management in patients with neuropsychiatric conditions. 10. Understanding and treating neurodegenerative disorders with psychiatric features. Alzheimer's disease and dementia. Biomarker advances. Identification of amyloid and tau protein biomarkers has improved early diagnosis and differentiation of dementia subtypes. Psychiatric symptom management. New pharmacological and non-pharmacological strategies are being developed to manage neuropsychiatric symptoms like agitation, depression, and psychosis in dementia patients. Parkinson's disease psychosis. Targeted treatments. Medications like pimavanserin, a selective serotonin inverse agonist, have been approved to treat psychosis in Parkinson's disease without exacerbating motor symptoms. Non-pharmacological interventions, cognitive therapies, and environmental modifications are being utilized to manage psychiatric symptoms in Parkinson's disease. Conclusion. The field of neuropsychiatry is experiencing rapid advancements driven by interdisciplinary research, technological innovations, and a deeper understanding of the intricate connections between the brain and behavior. Enhanced neuroimaging techniques, genetic and genomic discoveries, insights into neuroinflammation, and the development of novel pharmacological and non-pharmacological treatments are revolutionizing the diagnosis and management of neuropsychiatric disorders. Additionally, the integration of digital health technologies and the move towards precision medicine are paving the way for more personalized and effective interventions. As research continues to unravel the complexities of the brain-behavior relationship, neuropsychiatry stands at the forefront of improving mental health outcomes and enhancing the quality of life for individuals affected by these challenging conditions. Recent advances in geriatric psychiatry, an in-depth overview geriatric psychiatry, a specialized branch of psychiatry focused on the mental health of older adults, has experienced significant advancements in recent years. These developments span pharmacological and non-pharmacological treatments, technological integrations, diagnostic innovations, and enhanced care models. This comprehensive overview delineates the key recent advances in geriatric psychiatry, reflecting the evolving landscape aimed at improving the mental well-being and quality of life for the elderly population. 1. Pharmacological advances. New medications for neurocognitive disorders. Aducanumab Aduhelm, approved by the FDA for Alzheimer's disease, aducanumab targets amyloid beta plaques, potentially slowing disease progression. Its approval has sparked further research into disease-modifying therapies for neurodegenerative disorders. Lecanemab, another monoclonal antibody targeting amyloid beta, showing promise in clinical trials for reducing cognitive decline in Alzheimer's patients. B. Personalized medicine and pharmacogenomics. Pharmacogenetic testing, utilization of genetic profiles to predict patient responses to psychotropic medications, thereby optimizing treatment efficacy and minimizing adverse effects. This approach is particularly beneficial in managing depression and anxiety in older adults. Tailored antidepressant therapies, personalized treatment plans based on genetic markers are enhancing the precision of antidepressant prescriptions, reducing trial and error approaches. C. Advancements in antipsychotic medications. Lower dose antipsychotics, development of antipsychotics with improved safety profiles tailored for older adults, reducing the risk of extrapyramidal symptoms and metabolic side effects. Second-generation antipsychotics, SGAs. Enhanced SGAs offer better tolerability and efficacy for managing psychosis and behavioral disturbances in dementia patients. 2. Non-pharmacological treatments. Psychotherapeutic interventions. Cognitive behavioral therapy, CBT adaptations. CBT has been tailored to address age-related cognitive changes, focusing on managing depression, anxiety, and coping with chronic illnesses. Reminiscence therapy, engaging older adults in recalling and sharing past experiences to improve mood, cognitive function, and social interaction. B. Cognitive remediation and rehabilitation. Cognitive training programs, structured activities aimed at enhancing memory, attention, and executive functions, thereby mitigating cognitive decline associated with aging and dementia. Mindfulness-based interventions. Techniques such as mindfulness meditation are being employed to reduce stress, improve emotional regulation, and enhance overall mental health. C. Physical activity and exercise. Exercise as therapy. Regular physical activity has been shown to improve mood, reduce anxiety, and slow cognitive decline. Programs integrating aerobic, strength, and balance training are particularly beneficial. Dance and movement therapies, incorporating dance and movement to enhance physical health, social engagement, and emotional well-being. 3. Technology integration. Telepsychiatry. Remote consultations. Expansion of telepsychiatry services has increased access to mental health care for older adults, especially those in remote or underserved areas. Telehealth platforms facilitate regular monitoring and therapy sessions without the need for physical visits. Effectiveness. Studies indicate that telepsychiatry is as effective as in-person consultations in managing depression, anxiety, and other common psychiatric conditions in the elderly. B. Digital health applications and wearables. Mental health apps. Mobile applications designed for mood tracking, cognitive exercises, and therapy support are enhancing self-management and adherence to treatment plans. Wearable devices that monitor physiological indicators such as heart rate, sleep patterns, and activity levels provide valuable data for managing psychiatric conditions and detecting early signs of relapse. See virtual reality VR therapies. Exposure therapy VR environments are being used to safely expose patients to triggering stimuli, aiding in the treatment of anxiety disorders and phobias. Cognitive training. VR-based cognitive exercises offer immersive and engaging ways to enhance cognitive functions and rehabilitation. 4. Advances in diagnosis and biomarkers. Early detection of neurocognitive disorders. Biomarkers for Alzheimer's disease. Identification of biomarkers such as amyloid beta and tau proteins in cerebrospinal fluid and through PET imaging facilitates early diagnosis and intervention. Genetic testing. Screening for genetic markers like ApoE epsilon, 4-allele AIDS, and assessing the risk of developing Alzheimer's disease and other dementias. B. Neuroimaging innovations. Advanced MRI techniques, high-resolution structural and functional MRI, provide detailed insights into brain atrophy patterns and functional connectivity disruptions associated with psychiatric conditions. PET imaging. Enhanced PET scans enable the visualization of neurotransmitter systems and pathological proteins, aiding in the differentiation of various neuropsychiatric disorders. 5. Understanding neurobiology and genetics. A. Genetic studies. Genome-wide association studies, GWAS, identification of genetic variants associated with late-onset psychiatric disorders, improving the understanding of their etiology and potential therapeutic targets. Epigenetic research, exploration of how gene expression is influenced by environmental factors, contributing to the development and progression of psychiatric conditions in older adults. B. Neuroinflammation research. Inflammatory pathways. Studies have highlighted the role of chronic inflammation in neurodegenerative and psychiatric disorders, opening avenues for anti-inflammatory treatments. Microglial activation. Increased activation of microglia, the brain's immune cells, is being investigated for its role in cognitive decline and mood disorders. 6. Management of polypharmacy and side effects. A. Strategies to reduce polypharmacy. Medication reviews. Regular assessment of all medications an older adult is taking to identify and eliminate unnecessary or redundant drugs. Deprescribing protocols. Systematic approaches to safely taper and discontinue medications that may no longer be needed or are causing adverse effects. B. Safe prescribing practices. Guidelines for psychotropic use. Development of evidence-based guidelines to optimize the use of antidepressants, antipsychotics, and anxiolytics in older populations, minimizing the risk of adverse drug reactions. Non-pharmacological alternatives. Emphasis on utilizing non-drug therapies to manage psychiatric symptoms, thereby reducing reliance on medications. 7. Integrated care models. A. Collaborative care approaches. Multidisciplinary teams. Integration of psychiatrists, primary care physicians, psychologists, social workers, and occupational therapists to provide comprehensive mental health care. Coordinated care plans. Development of individualized care plans that address both physical and mental health needs, enhancing overall treatment outcomes. B. Geriatric psychiatry within primary care. Integrated services embedding mental health services within primary care settings to ensure holistic management of older adults' health, facilitating early identification and treatment of psychiatry between aging, neurobiology, and mental health. Advances in pharmacological treatments, personalized medicine, non-pharmacological therapies, and integrated care models are significantly enhancing the diagnosis and management of psychiatric disorders in older adults. Furthermore, the integration of digital health technologies and the emphasis on reducing polypharmacy are contributing to more effective and safer treatment paradigms. As the global population continues to age, ongoing investment in research, education, and policy development is essential to sustain and further these advancements, ultimately improving the mental well-being and quality of life for the elderly population. Recent advances in perinatal psychiatry. A comprehensive overview perinatal psychiatry focuses on the mental health of women during pregnancy and the postpartum period. This specialized field has seen significant advancements in recent years, driven by increased awareness, research, and the integration of multidisciplinary approaches. These advancements encompass improved diagnostic tools, innovative therapeutic interventions, pharmacological developments, understanding of neurobiological mechanisms, and enhanced care models. This overview delineates the key recent advances in perinatal psychiatry, highlighting their impact on clinical practice and patient outcomes. 1. Enhanced diagnostic tools and screening methods. A. Standardized screening protocols, implementation of universal screening, the adoption of universal screening for perinatal mood and anxiety disorders, PMADs using validated tools like the Edinburgh Postnatal Depression Scale, EPDs, and the Patient Health Questionnaire 9, PHQ-9, has become more widespread. Early and routine screening facilitates timely identification and intervention. Screening for anxiety and bipolar disorders. Expanded screening to include anxiety disorders, using tools like the Generalized Anxiety Disorder 7, GAD-7, and bipolar disorder ensures comprehensive assessment beyond depression. B. Biomarker research. Identification of biomarkers. Ongoing research aims to identify biological markers, e.g., inflammatory cytokines, hormonal levels that can predict susceptibility to PMADs, enhancing diagnostic precision and enabling personalized interventions. Genetic and epigenetic markers, studies exploring genetic predispositions and epigenetic modifications are contributing to a deeper understanding of individual risk factors for perinatal psychiatric conditions. 2. Innovative therapeutic interventions. A. Psychotherapeutic approaches. Cognitive behavioral therapy, CBT. Tailored CBT protocols for pregnant and postpartum women address specific challenges such as hormonal fluctuations, sleep disturbances, and stress management. Interpersonal therapy, IPT. IPT has been adapted to focus on interpersonal relationships and role transitions that occur during the perinatal period, effectively reducing depressive symptoms. Mindfulness-based therapies, mindfulness-based cognitive therapy, MBCT, and mindfulness-based stress reduction, MBSR, have gained traction for their efficacy in reducing anxiety and enhancing emotional regulation during and after pregnancy. B. Digital and remote therapies. Telepsychiatry and teletherapy. The expansion of telepsychiatry services, accelerated by the COVID-19 pandemic, has improved access to mental health care for perinatal women, especially those in remote or underserved areas. Mobile health applications. Apps designed for mood tracking, cognitive behavioral exercises, and psychoeducation support self-management and adherence to treatment plans. 3. Pharmacological developments, safety and efficacy of medications. Antidepressants. Recent studies have focused on the safety profiles of selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine. Reuptake inhibitors, SNRIs, during pregnancy and lactation, providing clearer guidelines for their use. Mood stabilizers. Advances in the use of mood stabilizers, such as lamotrigine and lithium, for managing bipolar disorder in the perinatal period, have been informed by improved safety data and monitoring protocols. Anxiolytics. The development of safer anxiolytic options, including non-benzodiazepine medications and enhanced understanding of benzodiazepine use, has improved anxiety management in perinatal women. B. Novel pharmacotherapies. Esketamine, approved for treatment-resistant depression. Esketamine offers a rapid-acting option, although its use in the perinatal population requires careful consideration due to limited data. Brexanolone Zulresso, specifically approved for postpartum depression. Brexanolone is an intravenous GABA receptor modulator that has demonstrated significant efficacy in reducing depressive symptoms. 4. Understanding neurobiological mechanisms. A. Hormonal influences. Estrogen and progesterone. Research into the roles of estrogen and progesterone fluctuations has elucidated their impact on mood regulation, informing the development of hormone-based treatments for PMADs. Hypothalamic pituitary adrenal HPA axis. Studies on HPA axis dysregulation during the perinatal period have highlighted its role in the development of depression and anxiety, leading to targeted therapeutic strategies. B. Neuroinflammation and immune system. Inflammatory pathways. Increased understanding of the relationship between inflammation and PMADs has opened avenues for anti-inflammatory treatments and the use of biomarkers to predict depressive episodes. Microglial activation. Research on microglial cells' role in neuroinflammation during the perinatal period has implications for understanding and treating neuropsychiatric symptoms. 5. Personalized medicine and precision psychiatry. A. Genetic testing and pharmacogenomics. Tailored treatments. Genetic testing to identify pharmacogenomic profiles enables personalized medication selection, optimizing efficacy and minimizing adverse effects for perinatal women. Risk assessment. Polygenic risk scores are being developed to assess individual susceptibility to PMADs, facilitating preventive interventions. B. Biomarker-guided therapy. Predictive biomarkers. Utilizing biomarkers to predict treatment response allows for more precise and effective therapeutic interventions tailored to individual biological profiles. 6. Integrated care models. A. Collaborative care approaches. Multidisciplinary teams, integration of psychiatrists, obstetricians, pediatricians, social workers, and mental health professionals ensures comprehensive care addressing both physical and mental health needs. Co-location of services. Embedding mental health services within obstetric and primary care settings improves access and reduces stigma, promoting holistic care for perinatal women. B. Community-based programs. Home visiting programs. Community-based home visits by mental health professionals provide support, education, and early intervention for at-risk perinatal women. Peer support groups. Facilitated peer support initiatives offer emotional support and shared experiences, enhancing coping strategies and reducing isolation. 7. Non-pharmacological interventions. A. Exercise and physical activity. Exercise programs, structured exercise regimens have been shown to alleviate depressive symptoms, improve mood, and enhance overall well-being during and after pregnancy. Yoga and Pilates. Mind-body exercises like yoga and Pilates contribute to stress reduction, physical health, and emotional balance in perinatal women. B. Nutritional interventions. Diet and mental health. Research links nutritional status with mental health outcomes, leading to dietary interventions that support both physical and psychological well-being. Supplementation. The use of supplements, such as omega-3 fatty acids and vitamin D, is being explored for their potential benefits in managing PMADs. 8. Policy and advocacy enhancements. A. Legislative support. Maternal mental health policies, advocacy for policies that mandate mental health screening and provide funding for perinatal mental health services has understanding the neurobiological underpinnings and leveraging personalized medicine approaches ensure that interventions are both safe and efficacious for mothers and their children. Additionally, the integration of digital health technologies and the implementation of comprehensive care models improve accessibility and continuity of care. It's neuroimaging techniques. A. High-resolution functional imaging. Enhanced functional MRI, fMRI. Recent improvements in fMRI technology have increased both spatial and temporal resolution, allowing for more precise mapping of brain activity associated with psychiatric symptoms. This advancement aids in differentiating disorders such as depression, schizophrenia, and bipolar disorder by identifying unique neural activation patterns. Positron emission tomography PET innovations, advances in PET imaging, enable detailed tracking of neurotransmitter systems, including dopamine and serotonin pathways. This precision facilitates better understanding of their roles in neuropsychiatric conditions and aids in the development of targeted treatments. B. Connectomics and brain network mapping. Brain connectivity studies. The field of connectomics has advanced, providing comprehensive maps of brain networks and their connectivity patterns. Disruptions in networks like the default mode network DMN, salience network, and executive control network have been linked to disorders such as autism spectrum disorder ASD, ADHD, and obsessive compulsive disorder OCD. Graph theory applications. Utilizing graph theory to analyze brain networks has revealed insights into how structural and functional connectivity alterations contribute to cognitive and behavioral symptoms in neuropsychiatric disorders. 2. Genetic and genomic discoveries. A. Genome-wide association studies GWAS, identification of risk genes. Large-scale GWAS have identified numerous genetic variants associated with neuropsychiatric disorders, enhancing the understanding of their heritability and biological underpinnings. For example, variants in the CACNA1C gene have been implicated in bipolar disorder and schizophrenia. Polygenic risk scores, PRS. The development of PRS allows for the estimation of an individual's genetic predisposition to disorders like schizophrenia, bipolar disorder, and major depressive disorder, facilitating early intervention strategies. B. Epigenetics and gene-environment interactions. DNA methylation and histone modification. Studies on epigenetic mechanisms reveal how environmental factors, such as stress and trauma, influence gene expression related to neuropsychiatric conditions. This understanding aids in identifying potential biomarkers for diagnosis and treatment response prediction. Non-coding RNAs. Research into microRNAs and long non-coding RNAs has uncovered their roles in regulating gene expression in the brain, offering new targets for therapeutic intervention. 3. Neuroinflammation and immune system involvement. A role of neuroinflammation. Cytokine profiles. Elevated levels of pro-inflammatory cytokines, e.g. IL-6, TNF-alpha, have been implicated in disorders such as depression, schizophrenia, and bipolar disorder, suggesting a link between chronic inflammation and psychiatric symptoms. Microglial activation. Increased activation of microglia, the brain's resident immune cells, has been observed in various neuropsychiatric conditions, indicating potential targets for anti-inflammatory therapies. B. Autoimmune neuropsychiatric disorders. Autoimmune encephalitis. Advances in identifying autoimmune causes of psychiatric symptoms have improved diagnosis and treatment, particularly in conditions presenting with sudden onset psychosis or mood disturbances. For instance, antibodies against the NMDA receptor are linked to anti-NMDA receptor encephalitis, which can present with psychiatric manifestations. 4. Neurotransmitter system research. A. Glutamatergic system. NMDA receptor modulators, medications like ketamine and esketamine, which target NMDA receptors, have demonstrated rapid antidepressant effects, revolutionizing treatment approaches for treatment-resistant depression. AMPA receptor agonists. Research into AMPA receptor modulators aims to enhance synaptic plasticity and cognitive function, offering potential benefits for conditions like depression and schizophrenia. B. GABAergic system. GABA modulators. New therapies targeting the GABA system are being developed to address anxiety, epilepsy, and mood disorders, providing alternatives to traditional benzodiazepines with improved safety profiles. C. Dopaminergic and serotonergic systems. Dopamine stabilizers, medications that modulate dopamine activity more precisely, are being explored to treat disorders like schizophrenia and bipolar disorder while minimizing side effects. Serotonin norepinephrine reuptake inhibitors, SNRIs. Advances in SNRI formulations aim to improve efficacy and reduce side effects for treating major depressive disorder and anxiety disorders. 5. Pharmacological treatments. A. Novel antidepressants and antipsychotics. Esketamine Spravato, approved for treatment-resistant depression, esketamine offers a rapid mechanism of action through NMDA receptor antagonism, providing quicker relief of depressive symptoms compared to traditional antidepressants. Brexanolone Zulresso, specifically approved for postpartum depression, brexanolone is an intravenous GABA receptor modulator that has demonstrated significant efficacy in reducing depressive symptoms. B. Traceamine-associated receptor 1, TAR1 agonists. Ulotaront CEP 363,856, a novel TAR1 agonist that provides antipsychotic effects without the typical dopamine receptor antagonism, thereby reducing the risk of extrapyramidal side effects. Early studies indicate efficacy in both positive and negative symptoms of schizophrenia. C. Psychedelic compounds. Psilocybin and MDMA. Controlled studies are exploring the use of psychedelics for inducing neuroplasticity and facilitating therapeutic psychological experiences in conditions like PTSD, depression, and anxiety disorders. 6. Non-pharmacological therapies. A. Neurostimulation techniques. Transcranial magnetic stimulation. TMS. Advances in TMS protocols, including personalized targeting and optimized dosing, have improved its efficacy in treating depression, OCD, and other neuropsychiatric disorders. Deep brain stimulation, DBS, refinements in DBS targeting and programming have expanded its use in treatment-resistant depression, obsessive-compulsive disorder, and Tourette syndrome. B. Cognitive behavioral therapy, CBT innovations. Digital CBT, online and app-based CBT platforms have increased accessibility and adherence, particularly during the COVID-19 pandemic. Integrative therapies, combining CBT with mindfulness and acceptance-based strategies, has enhanced treatment outcomes for various neuropsychiatric conditions. C. Cognitive remediation and rehabilitation. Cognitive training programs, structured activities aimed at enhancing memory, attention, and executive functions mitigate cognitive decline associated with aging and neuropsychiatric disorders. Neurofeedback, training individuals to regulate brain activity through real-time feedback, shows potential in managing depressive symptoms and improving cognitive functions.